2023. I call the meeting of the Westborough Board of Health to order. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, GL 30A, subsection 18, and the Governor's March 15th, 2020 order imposing strict limitation on the number of people that may gather in one place. This meeting of the Westborough Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the Town of Westborough's website at town.westborough.ma.us. For this meeting, members of the public wishing to watch the meeting may do so in the following manner: westboroughTV.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the Town of Westborough's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. With that said, first item on the agenda is the meeting minutes from August 26, 2020. Were there any comments or corrections needed for the minutes?
No, once again, thank you, Paula, for making such detailed minutes, please.
Okay, in that case, is there a motion? Nathan, you're on mute.
Thank you. Yeah, I'd like to make a motion.
Hey, which ones are we approving? Hold on.
I'm starting. Okay, so
do you want to do them together?
I got two copies, but it's the same. It's only one set of meeting minutes. Is that correct?
No, it's the 11th and the 26th, right?
The 11th
Paula?
and the 26th. Yeah.
Okay, so I was sent in my packet 2 copies of the 26th meeting minutes and no copies of the 11th. So.
Oh, sorry about that.
In that case,
you want to?
Let's stick with the 26th for the moment, and we'll come back to the 11th.
Okay. I'd like to make
oh, go ahead.
Dr. Hashmi, go ahead.
Nothing. No,
please go ahead.
I say we approve them. I make a motion.
Right.
Is there a second?
I second the motion that we accept the minutes from August 26th.
Okay. Any further discussion? We'll do a roll call vote. Dr. Hashmi?
Yes.
Dr. Walsh?
Yes.
And Dr. Ehrlich is yes. Okay, so minutes for August 11th. Any feedback from either Dr. Walsh or Dr. Hashmi?
Not from me.
I thought the minutes were fine. If you want to postpone it a weekend so that you have a chance to look at it, otherwise I'll make a motion.
You can make a motion. I'll just abstain, because I haven't had a chance to read them.
I make a motion that we accept the minutes for the August 11th Board Health meeting.
I second that motion.
Okay. If no further discussion, Dr. Walsh?
Walsh, yes.
Dr. Hashmi?
Yes.
And Dr. Ehrlich, abstain. Okay. Next, we come to the director's report for August.
I wanted to hear a little bit more about the chiropractic clinic and maybe what steps we might be able to take to help them come into compliance. I think you were reaching out to the state to see if they could help with the situation.
Correct. I talked to the Division of Labor.
And also, sorry, Steve, just one other thing, and were you going to discuss this later? I'd asked Steve to respond to there had been a concern about our color on the COVID map. So one of the residents, and I'm sure there are other residents that may did you want to discuss that separately with Dr. Ehrlich, with any direction? Sorry, go ahead.
Yeah, can we, unless it's directly related to the manager family chiropractic, let's take care of that and we can do your issue subsequently, okay?
Okay.
Great.
So Department of Labor and Workforce Standards reached out to me because, the complaint also filtered down to them. As I put in the notes that, we had a discussion and, they're claiming that, the people in there can't wear masks because of medical reasons, which is one of the exemptions that is granted under, the standards. So Department of Labor and Workforce Standard was going to look into maybe reaching out to the Division of Registration, which registers and licenses chiropractors, to see if they had any pull as far as, stepping in to try to make, the people there conform better to the COVID rules. So I'm still kind of waiting to hear back from them. My understanding with talking to them is that this isn't an isolated incident from chiropractors around the state.
Excuse me, Steve. You're fading in and out a bit. Just
Okay.
if you can be a little closer to the mic, that'd be helpful.
Okay, let me get. So, anyways, I'm sorry. Is this better?
It's when you say "is this better?" is what you were saying just before it wasn't. So right
Okay.
now it's good.
Okay. So anyways, Department of Labor and Workforce Standards is looking into it. I asked them is there something that I'm doing wrong that I'm not enforcing, and he said that no, unfortunately, that is the exemption, and this time there's really not a whole lot we can do if they're making that claim.
Okay. Any other comments or questions about that issue? Okay, Dr. Hashmi, you want to? You had an issue around the colors.
No, not an issue. I just wanted to know if maybe it's worthwhile, because a resident had reached out to me and to Steve. One of the reasons that people listen to our meetings is to kind of get a sense of where we stand with regards to COVID. So I didn't know if you and Steve wanted to discuss the numbers now or later, because people are listening.
Sure.
And potentially maybe discuss, if you don't mind, because everyone looks at the map, so it may be helpful just to discuss like why we're still yellow. I think that was the question that you were asked, right, Steve? Am I getting that correct?
So if you don't know, the state puts out a map I believe it's every Wednesday, which shows the rates per, I believe, 100,000 over a 2-week period for every town, and they color code it. I think it can be clear if you have no cases. It's green if you have a certain threshold, goes to yellow, and then it also goes to red. So just a little history on that. When they first put the map out, we started off yellow, and then we went green a couple of weeks, and now we're back at yellow, at least as of last week. Cases come and go. We've pretty much been averaging 7-8 a week. And a lot of this depends upon when they run the numbers. We get cases all the time, but when Ray and I do the investigation, sometimes those people don't even live in town anymore. They may have had the address wrong. So depending upon when they run the map, this stuff happens all the time. Stuff comes, it goes. I don't know what to say about the thresholds of the different colors. It's just that, I don't think it's unreasonable to say that we probably are not going to have 0 cases. We might 1 week here or there, but things are opened up. People are about. There's no vaccine. There's probably going to be transmission. So, at this point, we've kind of gone back and forth between yellow and green. I don't have a whole lot more to say. What could knock these numbers up, for instance, it's hard to talk about this without getting into real specifics, but you take 1 or 2 households in town, and let's say the households have 3 or 4 people, and one gets it and all the others get it in their household. I mean, there you go. Now you're going to have 6-7 cases right there, right? So if we're reporting 7-10 cases a week, it's very probable that it could be that we have 2 households with 3 or 4 people each and a couple other cases here and there. So it's tough to tell, again, I'm not telling you that's what we have, but that could be the case. We also have institutions here that maybe they get a couple cases there. So it really doesn't take a whole lot of cases to change the color coding.
So let me speak to that, Steve, if you don't mind. So currently the way it works is we're looking at the color coding is based on the average daily case rate per 100,000 population. And green means that it's less than 4 cases per 100,000. So that means over the course of a week, you have less than 28 cases if you have 100,000 population. Now, of course, Westborough doesn't have 100,000 population. Westborough has a population, it's less than 20,000, but let's just arbitrarily say it's 20,000. Well, then if we have 5 cases per week, then our case rate per 100,000 is going to be 25. And if we go to 6 cases per week, we go to 30, which is popping you into yellow. And so you can see that because we have a small population and it's per 100,000, it's very easy. 1 more case is the difference between green and yellow off of still what are fairly small numbers. And there's going to be randomness in the numbers that Steve indicated. So I think people have to be comfortable that there may even be a week when it's red, although that, that would be for greater than 8 cases per 100,000, which means we'd have 40 cases. So I'm sorry, you'd have 56 cases per week, and then if you divide that by 5, so if there's, if we're having 11 or 12 cases in town, then that's going to pop us into the red range. And again, if you have an outbreak in a particular particular household, it's possible that might happen. But I think we should expect to be in the green-yellow range most of the time.
So just as a question or a comparison, if we look at some of the towns like Northborough or Southborough, they've been in that kind of clear range most of the time that I've looked at them. Their populations aren't hugely different, and so I do want to express that we shouldn't just accept, 7 cases a week as, hey, it's pretty good, that we don't really need to worry about it. I mean, we could do better. I just want to make it clear that, we're not perfect right now and that there is room for improvement, because, some of the surrounding towns are doing better and some of the surrounding towns are doing worse. And so it is nice to have that as a comparison as to where we are.
Yeah, just to be clear, in the color coding, you have less than 5 cases over the course of the week, period. Not per 100,000, just absolute numbers.
Yep.
Okay, so anything else about that, Syed?
One other, and I hate to sound like an old fuddy-duddy, so just please, if there are any teenagers that are watching, please forgive me. I don't know if you guys were aware, a couple of the school districts had to do a completely online learning because of some large house parties. I didn't know if any of you had read about that. And I was just going to remind people that it is incumbent on all of us just to take care of each other. Just please, there are tremendous consequences of large gatherings of people that put us all at risk and, could substantially change what the school is doing. So please be careful.
Okay, I think we will. It's now 5:46. I'd like to suspend our current discussion of the director's report and pick up the issue around the review of the health inspection reports and potential probation for the bistro. So perhaps I'll start with Erin. If you want to introduce the subject for us and give us a little bit of background, please.
Yes, sure. So I did print off in the packet a violations review of the bistro, starting in August 2019 when the pre-opening inspection happened. The new owners are on the conference now. Hi.
Hi, everyone.
Actually, before you continue, Erin, if you could just both give your names for the record for Paula for the minutes, please.
Of course. I am Albana Plaza, and my husband, Arben Plaza.
Are you residents of Westborough or not?
No, we don't.
Okay, fine. Okay. And you are the owners of the bistro. Is that correct?
Yes.
Great. All right. Please continue, Erin.
Sure. So the first inspection we had required 2 re-inspections. So there was some outstanding things in the re-inspection that I needed to come back for. We did have an administrative meeting with the owners in January, and that was Steve, myself, and the owners, and we went over, the policies and procedures, our probation policy. This was just the regular meeting that we have with all new owners of businesses. And then in June of this year, a routine inspection showed serious violations that I wasn't comfortable keeping them open at that time, mostly having to do with temperature issues. So a re-inspection did happen 2 days later once they had all the issues fixed and they were allowed to open. There's been quite a few serious violations at each inspection we've been at. And I think it's just a good idea to chat with them to see what's going on and just see what your thoughts are on that.
Okay, so speaking on behalf of the board, I think, for a facility that has only had 2 inspections and both are concerning to us, we thought it was important for you to come before the board to try and explain what the problem is, if there is a problem, or that we can try and get to an understanding as to how things will be better in the future going forward. So whatever comments you wish to address the board, please proceed.
Sorry, I have to translate to my husband.
Sure. Yeah, we will take the time, but again, do you have any comments in response to my remarks or what Erin had presented?
Yes, it was a very, very hard and difficult time for us since we were in a hard transition. We were changing the whole stuff that we find here at the bistro. We were bringing here new people, and it was even the pandemic situation. We were forced to do all the procedures by ourselves. Me and my husband were working on kitchen in morning, serving all day here, and then until 1 or 2 a.m. in the morning, we did the bakery stuff, the bagels by ourselves. It was very difficult for us to hire more people, to have more staff, and the people that honestly we have in the morning helping were people that were prepared to leave this job, and you can imagine how much they could do their job.
It looks like your husband may want to be saying something. Does he have anything he wishes to add, or he's already communicated through you?
No, he wants to say something.
Thank you very much.
He's thanking you.
Kemi marrë restoranti, kanë qenë gjitha pajisjet tepër të vjetra dhe kemi një vit që kemi marrë njerëz që kemi rregulluar disa herë makinerit.
Okay, Arben is saying like this, that when Erin came, she noticed ice machinery that was out of service, another walker was out of service, and he's saying that if you see our invoices from 1 year, we have only 1 year having this place, how many times we have repaired everything that is in kitchen, it's too much, he's saying. We have lots of other invoices to come because, I don't know, but when we came, everything was just fixed, but we didn't know. We didn't notice this, that everything was quite dead in the kitchen. So we are enforced that time after time, we notice things that are not working anymore. For example, today we had a very good day at Bistro and the toastier didn't want to start, it was too old. When we reopened it, we saw tape on the electrician, I don't know how they are said, the thing that goes...
The cord.
Yes, we saw lots of things that were made manually before we owned this place. So every day we see something new here, unfortunately.
Yes, so I'd like to make a few comments if I can, Alan.
You can. I'm going to ask Dr. Hashmi just to mute again, and we'll all mute while Nathan is asking his questions.
Okay.
So one of our jobs as the Board of Health, it's really important that we try to protect the people of Westborough, and the way we do that is by having very high standards.
Thank you.
And one of the things that, part of that is that for a lot of restaurants that are doing well, we're typically inspecting them twice a year. When restaurants are not performing the way we want to, we do have something that we call probation. And with probation, the way it works is that we increase the number of times that we go in and inspect to 4 times a year.
No, we
And so-
understand this.
And so what we're thinking is that the performance that we've seen so far hasn't been what we're looking for. And so we're thinking that we might need to increase the amount of inspections that we do in order to try to make sure that you're, working in a safe environment for the people of Westborough. And then if things start to improve, we can, usually we revisit it every year, and then we can take restaurants off of probation at that point in time. So it's not a permanent process, and the goal is to actually get you guys to be sufficient, so that you can do it yourselves. So that way we don't have to constantly be checking in on you. We want you guys to be having all of the procedures in place so that you know what to do and that you're doing it yourself.
Thank you.
So that's what I wanted to get across, Alan.
Sure, thank you. So, we again, in support of what Nathan had said, one of the things we want is for businesses in general and restaurants in particular to be successful here in Westborough. We do not try and impose undue burdens. We want we want to be reasonable, but at the same time, we enforce what we think are minimum standards to help ensure health and safety of everyone who either lives in or visits the town and is eating in various restaurants. And so, if you find yourself in a circumstance where you've moved into a new facility and it wasn't as you expected, and there are extra costs that you have to incur in order to meet the minimum standards, from our perspective, that's unfortunate, and we wish it were not so, but you still have to meet the standards.
Of course.
Okay, and so if things need to be repaired, or replaced, depending upon what it is and the impact on the safety of food preparation, you can work with Erin and Ray, and they can help come up with a plan for things that need to be done and in what order. But again, there are minimum standards that we cannot go below. And the reports that we have seen so far are concerning. One of the greatest threats to food safety is when food is not maintained at the proper temperature. So these are the things that we are concerned about. And usually when it's a new restaurant, they do pretty good in the beginning. That's usually when you have your best effort, and problems accumulate over time. And so when we see problems from the very beginning, it's extra concerning. I don't know if you have any response or not. Otherwise, I'm going to ask Dr. Hashmi if he has any comments to make.
No, I have to say only about the moment that Erin came, seeing that it's very hard having lots of employees. I was trying to explain Erin that we don't take the dishwasher, we don't, so his time is not from 7 o'clock that we open. He comes about 11 and stays until the end of the day. That was the idea that, for example, the dishwasher place was full with dirty plates because he doesn't come since in the morning. He comes about 11 o'clock.
Erin, you want to comment on that?
Sure. So I completely understand that. However, when the issue is that you can't leave dirty plates for long periods of time in a restaurant because it attracts pets, bugs, and I think that was part of the issue during the inspection.
No, I understand this part. That's why I remember this part, because it's still very difficult, but now we do the different thing. He goes in and do the dishwasher in morning to not leave lots of plates there until the dishwasher comes. But this was the idea that I wanted to explain.
Okay. Dr. Hashmi, do you have any comments you wish to make?
No, I just wanted to. I understand that these are difficult times for all of us, and I can see that you are also struggling. And as my fellow board members have said, we're not unsympathetic to that. But it is our job to make sure that we don't put our residents at risk. So and as my board members have said, we are here. We are here to help you succeed. If you succeed, our town succeeds. That is our job. We want people to come to your restaurant. We want you to do well. We want you to open more restaurants. That's how, and we want you to, and our job is to help you do that. Thanks, Dr. Ehrlich.
Thank you.
Okay, so my feeling is that either we should change your status to probation at this time, or we should await one more inspection, and if that next inspection is not adequate, I would be very inclined to do so at that time. And I put that out for my fellow board members to comment on.
Aaron, it's Syed. Hello?
Go ahead, Syed.
I'm here.
Is Aaron on the line?
Yes.
Yes, I am.
Aaron, so when is there? So I know you just did this inspection. When would the next inspection be by your standard?
January-ish.
Yeah, it would be about 6 months.
Oh.
I'm sorry. No, it's about December or January. I mean, I can do it earlier if need be.
Can we? So what happens? So Steve, I'm sorry. What happens if we request what if we do an inspection in November? How does that work? Would that be a part of the probation inspection? How does that?
Well, if you wanted us to go in November and wanted to see how things went, we would just do it. And then if you wanted to see how have probation based upon that, then whatever you want to do, we'll just do it. It's up to us.
I mean, one of the issues, Syed, is that it costs us extra to go in and do extra inspections. And so by putting someone on probation, that allows us to pay for those additional. So if
I understand, but I'm just saying that these are first-time restaurant owners. Before I would just like to have an inspection just to get a sense. I mean, maybe in November we can just do it, and fine, if the thing fails, you guys know me, I'll be the first one to say that this is we need to put them on probation, but I just feel that we should give them a chance.
Nathan, any comments?
I don't feel strongly that we need to put them on probation. I'd be okay with it. I'm not convinced that it definitely has to happen. The other thing that we sometimes recommend to companies too that are struggling is having a consultant that they hire to help them look at their process and how they're doing it. Sometimes that helps get people on track too. Usually,
I forgot about that. Yeah.
They have to. Yeah. So, are you good?
Ivana, did you hear and catch what Dr. Walsh had said? I was unsure if you were translating at the same time. But he was saying some facilities have hired consultants to come in and help them get their processes in place and they can even do a little mock inspection before the normal schedule to make sure that everything is as it's supposed to be. So that's something else that you might consider. What I'm hearing, and I want to try and move the meeting along, what I'm hearing is a little bit of ambivalence one way or the other for whether to go with probation at this time or wait for another inspection. And I'm okay with waiting for another inspection, which would be November, December timeframe. And I don't care if it happens in November or December. But if the next inspection is not substantially better than what we've seen before, there will be little doubt that everyone here is going to want to put you on probation, which is not, it's not good for your reputation. It's not good for, your efficiency. It costs you more money.
So, Dr. Ehrlich, can we make a plan to have would we agree that can we encourage Steve and Aaron to do the inspection in November and follow up with us in December? Can we agree on that?
Sure.
Okay.
We don't need a motion for that.
Okay. Is that okay with you, Steve and Aaron? Would that be all right?
Everyone's nodding their head yes.
Yeah, that's fine.
Okay. Okay.
Yes, go ahead, please.
Say something, yes.
Please, go ahead.
Ju faleminderit për bisedën që bëm dhe për dëgjimin ju dëgjom ju.
We really appreciate what you are talking about.
Inspektimi i fundit që ka qenë nuk ka patur asnjë lloj kritike. Jo. Inspektimin e fundit që ka ardhur ai djalin. Po. Inspektimi i fundit ka qenë nuk ka patur kritika. Ka qenë frigoriferi dhe makineria e akullit ka qenë nga problemi I shkëputjes të energjisë elektrike.
Okay, Arben is trying to say about the last inspection that Ray was here. I don't know if you were talking about this, but he's saying that everything here was perfect, that period of time, except of the ice machinery and one walker that was caused because of the electricity of the problem that happened on the building, not especially at Bistro. The water leak and whatever happened to the landlord, it caused us that one walker and the ice machinery went out of service. But it was everything else. It was perfect here. It was a period that those days that we were closed, about 1 week, we did a very, very good cleaning or moving everything here at Bistro because we had enough time. It was about 1 week closing.
Yes, I think that you're referring to the July inspection, and I don't think that was a routine inspection. That was one where
no, Nathan. This was subsequent.
Oh, okay.
It's in the Sanitarians Report about the building closure.
Yes, the building.
Yeah, we'll come to that.
Yeah. Okay. He's speaking about that part. He wanted to clarify that it wasn't the problem before that. It comes after they had the problem on the electricity, water, whatever they had.
Yep. Okay. I would say that we appreciate that there is response to the feedback that you've been getting from Aaron and Ray, which is good.
Of course.
I just want to emphasize the rules that we're talking about. They're not special rules. These are not special rules just for the bistro. They apply to all restaurants. They apply to all restaurants, and most restaurants have very little trouble, maintaining their restaurants according to these rules. So, okay.
All right. Is that the end of this discussion, Dr. Ehrlich?
Unless
comments, and then
I'm sorry, Nathan. I missed what you said.
We should see if the plazas have any final comments.
Do you have any final comments? Otherwise, we're going to move on to other business.
Of course, I'm sorry to find ourselves in this situation because we had lots of other plans and projects for the bistro when we buy this place. We weren't prepared to face with the pandemic or with some personal problems that came out, not because of us, but because of persons that we bought the business, the employers that we found here. We were totally unprepared about these situations.
Okay. All right. Well, we hope that the next inspection is a good one, and otherwise we will be seeing you back, which I would rather see you at your facility than on the Zoom call. Okay.
Thank you.
All right. Thank you.
Thank
All right,
you.
Dr. Hashmi.
Dr. Ehrlich, I have to leave also, so
Okay.
I'll follow up with you guys later, okay?
Very good. Okay, next item on the agenda is discussion of the standardized exams from Westborough High School, and Mr. Ryan, I believe, is on the call. So this is a follow-up to a conversation we had back in the day when we were meeting with the Board of Selectmen on a regular basis, and the issue about whether Westborough High School being a venue for standardized exams would be feasible. A plan was put forward, and I think we had requested just an update afterwards how things had gone. So, Mr. Ryan, if you could share with us your experiences and thoughts.
Sure, more than happy to do that. We've had 2 exams, that have taken place since the end of August up through the beginning here. And both exams had about 240 students at them. I followed the procedures that we had provided to you before. I have 2 nurses that are conducting intake of students. The students are going through an attestation telling us about their exposure to COVID, the likelihood of it, that they're not violating any travel bans, and agreeing that they could be susceptible inside of the building. There's no more than 11 students that are inside of a room with one proctor who's in the front of them. I have them isolated into multiple different regions with approximately 6 or 7 rooms per region inside of the building. Each of those regions all have their own individual bathroom. The breaks are set so that when students first come in, they are relatively isolated by letting them into the building and getting them into their classrooms as quickly as I possibly can. The breaks are staggered so that they do not come into close contact with each other at that time, and they're released at varying times so that there's not large gatherings that are after they leave the building. They generally get inside of their vehicles and drive away. To the best of my knowledge, we haven't had any COVID cases that are reported. Of course, the exam last weekend, it would be too early to be able to identify anything from that, but the exam from 2.5 weeks ago, I would have thought I would have heard something, although there is no official reporting procedure that would go along with that. I wouldn't know. The nurses have been, I don't know whether I would say that there was tremendous value of them there, but I certainly think that it's a very good thing with their experienced eyes to be able to look and to ask questions. I do know this last weekend we had 2 individuals from Rhode Island that appeared. One came with a COVID negative test because of the travel ban, but the other one did not. And as a result of not having proof of quarantine or of any COVID negative test, that person was denied admission to the exam. I think that pretty well covers the summary of what is going on. I'm happy to answer any questions if you want to know anything more specific.
Nathan, if you want to start, or else I have a question or 2.
Go ahead and start, Alan.
Yeah, so first of all, the student who was turned away from Rhode Island, do you know, do they get allowed to take it subsequently without having to repay fees? Is that how it works?
They do. Both the SAT and ACT have told me that they will support any decisions that we make at the door, and they will do everything they can to just allow those students to transfer to one of the upcoming exams. It, of course, is a little bit problematic because they haven't had many exams last spring and up through right now. So there's a lot of seniors that are concerned about not having those exams. But, of course, that's not what we worry about with health. We're more worried about the student safety while we're there.
Okay. The other question for Steve. Steve, to the best of your knowledge, has any case in town been in some way linked to the testing?
No, we have not had anything that we could link to the testing.
Great. And then I guess my last question for Mr. Ryan. So we are doing this. To what extent are other towns around us doing testing? Are we acting as a magnet for a lot of places because we have, in fact, got effective procedures in place and we're willing to do this? Or is it becoming more widespread that most of the places that would typically offer testing are doing so?
Most of the places that offer testing are not offering testing, but my test center has been filled. I reduced the capacity early on, so my test center is full to capacity all the way through December. However, of course, I told both organizations that whether we could actually conduct the exams was dependent upon your approval.
Okay. I have no further questions.
So I don't have any questions, but just I'd like to make some comments, and that's that, I appreciate Dr. Ryan that you're operating this test center here in Westborough. I think it's the benefit of Westborough and the Westborough students, and I think that as long as we can balance the health of students, as of this point, we are still in favor of having you continue to run this testing. If we start to suspect that cases are being transmitted among the student population, especially at the test sites, we will definitely reach out and let you know. But as of this time, I think that it's safe to operate under the assumption that you can keep offering these testing.
Thank you.
And I will make one last comment. So I introduced you as Mr. Ryan, and I apologize, Dr. Ryan, because when he said Dr. Ryan, it suddenly clicked on me. I assume you're the AP Biology, Dr. Ryan. Is that correct? Yes. All my kids had you and loved you. So I just did not recognize you on a Zoom call.
I understand.
Okay. I think that's it, and we appreciate you giving us the report, and we hope we continue to be successful going forward.
Thank you very much. I appreciate your efforts.
Yep.
Thank you.
And I just have a comment to the Plazas. You're welcome to continue watching the proceedings. You don't have to. It's your choice. If you find it interesting, please stay on the call. Okay, we're back to the director's issues, and let's just
the chiropractic. And I guess I did have one other question about Crunch Fitness and the sense of are they making any improvements, or are they still kind of where they were before?
Well, when I was there the day that obviously it's one shot in time. It's a snapshot of when I go in. I would say probably 80% of the people had masks, although in gyms you are allowed to not have a mask if you're 14 feet away. And that was what was going on the cardio area. So, I think overall they were complying when I was there. I have no doubts that at one time or another, I'm sure there's someone walking around without a mask in there. But the manager that was on duty was very knowledgeable, actually, and cooperative, and she seemed to be doing a good job. So, we haven't followed up yet, but we'll just kind of, we'll wait and see.
Did you have anything else, Alan?
No. So maybe go ahead.
Did we accept the director's report for August 2020?
I'll second that. Roll call vote. Dr. Walsh?
Walsh, yes.
Dr. Ehrlich, yes. Okay, Sanitarians Report.
So in responding to the request that we had, so I guess let's see, with the bistro and Scoops and Bites, I know they've left the phone. This is more just a follow-up. We had asked them to send pictures or verify the disposal of food. Did they both do that? Is that something that's routine and happened?
Yes. At the we'll start with the bistro. The bistro had emptied everything out when I went in there, and I understand they were saying, "Oh, he came in and said everything was great." I was just checking 3 or 4 items. I wasn't checking. I wasn't doing a full inspection. I went in there to make sure there was no food there and that they cleaned the coolers, which they did. And at the other location, Scoops and Bites, I had contacted her at like 7:45 or 8:15 in the morning, woke her up. She went down there and she was able to strip her. She has another commercial cooler, a freezer. So she was able to move all the expensive stuff and she threw away the rest. So she said the landlord didn't call her till 11:30. If I hadn't called her, she would have lost everything.
I would make a comment. Obviously, a significant portion of your report is related to masks and COVID-19. Yeah, I'm not sure what more we can do. I just want to note for the record that I understand that you and the rest of the health department staff are doing the best we can to try and encourage the compliance with the state mandates. And it is at least my philosophy that I think the board has articulated this, that we wish to take a route of working with the various establishments in town, trying to help them do what they're supposed to do, and not to take a punitive approach.
So I have two more questions, I think, about this report. One is more of a comment, I guess, and that's with Julio's Liquors and the state coming back and saying that if they want to verify somebody's ID and they need to match a face to the photo, that people have to take off their masks so that they can actually see if it's the right person.
Yeah.
And I just kind of, if people are listening to this call at some later date, I just want them to be aware that, yes, we are telling the liquor stores that they do still need to verify ID, and that if, in order to do that, they have to ask someone to remove their mask, that is what the state is recommending.
And on top of that, the danger of having the mask off is primarily when someone is coughing or sneezing or even talking. But if you're just breathing through your nose and you pull your mask down for a few moments, the likelihood that you are going to either transmit or receive COVID-19 is very, very low.
Yeah. And then the other question that I had is on the 21A Water Street, where I guess there was John's and other construction material and stuff out there. I think we were handing that off to the building or the zoning department. And I just kind of want to make sure that things don't fall through the crack. Did they take ownership of that, or is it still kind of not really
it's one of those things where I know this has been I can't say, well, in the last couple of years, it's been an issue. He was not able to build on his lot. So he's trying, it's kind of little sticking points for him. So he told a couple of years ago when something happened, he told the building department that, well, I have this land in town that I can't sell because it's not a buildable lot. I have to do something with it. So he was storing stuff there. They made him remove it. Some of the stuff he's storing now isn't trash, so it doesn't fall on us. So it falls on building. I did contact them, and they said they were going to handle it. So they could be in contact. I'll check with Bill tomorrow, see if anybody's done anything about it. But it's not. They don't usually report back to me if they've done it or not. I just kind of have to leave it up in their hands.
Okay. No, it doesn't sound like it's an iron issue. So you're probably ready. You don't even need to follow up. I think that having handed it off is the right thing to do.
Okay.
Did you have anything else, Alan, on this report?
I don't.
I'd like to make a motion that we accept the Sanitarians Report for August 2020.
I second. We'll do a roll call vote. Dr. Walsh?
Walsh, yes.
And Dr. Ehrlich, yes. Okay, Health Inspector's Report. I was a little bothered by the Max Wraps situation where that was one thing where basically Cold Harbor, who should know better, just gets them to go in there. There's no permit, and then you get a permit application after the event's over. It's sort of a little backwards.
Yeah, that was the second one actually that happened at Cold Harbor. The first was right above it on my report, Travel and Bones. So Cold Harbor has been kind of a constant struggle with us. On our end, we permit the food establishments. The COVID and the liquor license stuff is kind of in the selectman's office hands, and but yeah, they have had a few food trucks come in without being permitted.
And so at this point in time, if I understand correctly, the state has basically walked back a little bit about those places that don't have their own food or that are using catering trucks to kind of make the bar able to be open. Is it correct that at this point, a place like Cold Harbor Brewing is not supposed to be open, or are they supposed to be open?
Well, That's a good question. It depends upon what they're doing. So my understanding is if they have the food truck there and the food's being prepared on site and there's table service and that food is being served with alcohol, that they, can be open. But this is something that the ABC Alcohol Commission has kind of taken over, and we've kind of stayed hands off as far as that. They're the ones that should be enforcing the alcohol part of this thing. So we've kind of stepped back, and we just want to make sure that the food part is, our serving food, we're making sure that it's, permitted properly.
And if we reached out to the ABC to let them know that this is a place that they should send an agent over to inspect?
Yeah, I believe the selectman's office has. So I don't know where that's at, but I know that there was some concern to make sure that the things were being done supposed to over there.
Good, excellent.
South Street Diner.
Yes.
What's the deal? It's not like they just opened up. How hard is it for them to understand what the rules are and comply? This is not a complicated thing. You go any single restaurant, they either have you use your QR code or they hand you a paper menu, and it doesn't get used by anybody else.
Right. You're talking about the complaint. Yeah.
Yes.
It was definitely noted that they were reusing the menus. It was very obvious.
What was their justification, if any?
They claimed that they weren't.
Okay.
I had them discard all the menus.
They also had a number of violations this time on the inspection earlier in the report. And, where the PIC knowledge was lacking, they had, improper cooling times, and, they had a various number of issues in this report as well. It's not the first time they've had issues. They routinely see issues with this place. We've had the owners in before. It's and then kind of have them just tell us that, oh yeah, no, we're not reusing the menus when they clearly are. They're just almost flagrantly, violating, what we want of them.
Yeah, they've definitely had violations in the last. I can't count how many inspections between Ray and I. We've seen quite a few violations there.
I mean, this could be one that we want to bring in before the board and possibly put them on probation, right? They're currently not on probation, is that right? Yeah.
They are not, no. And I'm happy to put together a list of them as well.
That would be good for the next meeting if you could just put a summary of what's been going on. Thank you.
Sure.
So not have them in, but just have a summary ready?
Let's have a summary. Let's talk about the next meeting when Syed is present.
That sounds good.
Those were the only issues I wanted to talk to you about.
Let's see. I just wanted to check on the number of written warnings we're giving and whether we need to move to any other stage in the violation process where we try to then issue fines or penalties.
Have we issued any written warnings in the last month? I mean, we've gone out and obviously.
I think the New York Kelly was just given one.
Right, and then they were brought in after that.
Yeah, and obviously you are all well aware of that because we had them on the last meeting. But I don't know. Maybe I'd have to go back and look through the record whether we received anything from them. But other than that, I don't think we've written any other warnings.
It's Toyota. I wrote one for Westborough Toyota.
Westborough Mobile was given a written warning.
Maybe I should let my inspectors answer that
question. Steve, we keep this day-to-day stuff away from you and let you handle the big stuff.
Yeah. So do either you or Aaron or Ray feel that we need to do something more than written warning at this place at this point in time?
I don't. I'm talking. If we talk about Westborough Toyota, I got to get down there and talk to another manager. I need someone in charge of the whole place because one time the complaint is on the service department, another one is on the sales department, another one is on the parts department. So I've gone to different places, and when I go back, I notice the ones that I've corrected are doing what they're supposed to be doing, but they don't seem like they're passing the information on because this manager may only be able to run this side, and because that's where the complaint was, that's what they're doing. So I don't know how we want to. I think that right now, I think we're working all right.
Right, and that they've got a small cafeteria and then like a lot of just regular business.
Yeah.
You know, most of their business is not the restaurant. And so
The restaurant just reopened last week.
Yeah.
So they don't have any seats or anything like that around the restaurant.
Okay. Good.
Let's just keep an eye on it and see what happens.
Okay.
Yeah. And then, see, with the temporary event, the Sikh temple wedding, did that go okay? Were there any issues that we thought might come from that, or anything coming up in the reports that might be related?
So I was not able to inspect that actual event. I did contact the town that they were located in, though, and get their previous inspection reports, which were fine.
Okay.
No, nothing, concrete about any kind of like problems with transmission or anything.
Good. Okay. I'd like to make a motion then that we accept the health inspector's report for August.
I'll second that. Roll call vote. Dr. Walsh? I'm sorry. Yes? Okay. And Dr. Ehrlich, yes. Okay. Back to now we can do director's issues.
Sure. So first one is the dashboard from the high school. As far as reporting, the daily occurrences of different things went live today. And so it has every day, I can log on sometime around 3:30 or 4, and all the schools will report any kind of incidents. So what they have on is they have categories like the number of students dismissed with symptoms, number of staff dismissed with symptoms, new positive cases in students, positive cases in staff, close contacts identified, how many people are currently in isolation, how many are in quarantine. So those are the data points that they're tracking right now. Of course, we may need to change this as things go along, but like I said, every day I can log on and those will be reported. And I believe the schools are going to be putting this out weekly on their site. I think that's what I read somewhere. So, anyways, I don't know if you have any comment or questions about that.
So I haven't seen the dashboard, but one of the things that people do a lot of times is when the categories are such that there's less than 5 people in a category, instead of giving an exact number, they typically just say less than 5. And so it would be nice if the dashboard that the school is doing was, if this is a public dashboard, that be taken into account.
Yeah, that's a good idea. I'll contact them tomorrow and just suggest that their numbers will be on a weekly basis, whereas mine are on a daily. But again, yeah, I'll mention that to them.
This is the dashboard, sorry, for you, Steve, or this is a public dashboard?
This is what I just wrote. I will be able to see the numbers on a daily basis. Okay, so that if something, the reason for this is if there's a concern, I can bring it to the board immediately, right? Okay. I believe the schools are going to post this once a week with weekly numbers, right? So, but yeah, your comment about maybe putting less than 5, I'll pass that along and see if that makes sense to them.
Yeah, so that you should get the actual numbers, Steve, being Board of Health. But you're right, when it goes public weekly, that should be the one that we should encourage them to use numbers like less than 5.
Okay. So anyways, I'll keep you updated on that as, like I said, school's just slowly rolling out right now as far as in class, and I believe they'll pick up next week, pick up more. So we'll see how that goes. I don't know if the board want to have any kind of discussion about the, a couple of requests we've had from the school to review different things, especially on spacing and things like that. We as you both know, because you both commented, and I thank you for the comments on that, we get specific questions about specific situations that the school would like us to comment on, whether we think, a certain layout might be safe or not safe, or certain practices are safe or not safe. So I don't know if we want to be specific about that, or we just want people to let people know that, when those concerns come up, that, both Dr. Ehrlich and Dr. Walsh are very responsive to providing their opinions, and we pass that along to the school.
Yeah, I have a few comments about that. So the first of all, we have looked at the overall plan that's been put forward, and as a board, we have given our opinion that it meets at least a minimum standard of safety for both staff, students, and anyone who may be coming into the school. That being said, safety is not an all or none phenomena. It's a spectrum, and there's more safe and there's less safe. And you can have a threshold where you say anything below this is considered safe, but within that safe zone, there are still different options that can be selected. For various reasons, sometimes people may wish to have something that goes to a greater extent than the minimum, but that's not it is not necessary. But circumstances may make that a desirable option. So to that extent, when we look at things, we take as a starting point that is this in violation of the minimum standards or not? And if it is beyond the minimum standards, then what is the specific question being asked of us for why our input is being requested? So we're happy to give our input when there are specific concerns, but if something is just in compliance with the rules that have been laid out by the Westborough Public School System, DESE, or the governor, then for the most part, we're going to we can confirm that, but our input really isn't necessary. Although, again, we're always happy to clarify where there may be some uncertainty. And Dr. Walsh, I don't know if you have comments about that or on the broader subject.
No, actually, I agree very much with what you just said. I think that both of us are, right now, the number of requests that we're getting in are manageable, and so we don't mind looking at specific items. We do take this seriously, though, and every request we get does actually get a fair bit of attention from us. So, we do spend a lot of time thinking about this to making sure that we give an appropriate answer. We do value the safety of people and, of teachers and of staff and of students, and we try to, do our job the best we can. The feedback that we provide has mostly been going to Steve, and then Steve has been kind of taking what individual people have said and hopefully feeding that back. If you haven't been feeding that back, then this would be an appropriate time for us to bring up specific issues. But if you've been feeding back people's responses, then I think that's sufficient.
Yeah, I always get back to the people. So I just wanted to make that announcement that we are involved in that. Actually, besides that, I really don't have too much else.
So I have a couple of school-related issues from a prior meeting. I think that when Amber was here, there were two items. One was that she said that she had a map of all the rooms in the schools with the allocations to how many kids could fit in each room, and that she was going to provide that to us. And I wanted to check to see if she had actually given that to us yet.
I haven't yet, but I will follow up tomorrow and get that to you when I get it.
And then the other item that we talked about was that DESE has required that the schools and districts provide a COVID-19 response person for each district and for each school. And I think that the last meeting where Amber was at, she basically said it was going to either be her or the other person.
Suzanne. Yeah, it was Suzanne Kenny, I believe. Yep.
Yes.
Yeah. Yep. But you didn't know exactly which of the two people it was going to be. It would be nice if we did have a designated person. That way we knew who all the official communication should be routed to. Or else we could just make that decision for them and, decide to go through Amber Bach because that's, the most relevant person. But again, I'd like them to pick it, but it is required by DESE, and I'd like to, make sure that we know who we should be communicating to.
I can follow up on that also.
Thank you. And then did you send out the DEP letter regarding kind of our response?
I did. I think I sent it to you to make sure that, and I know they got it. I did receive an email response on the master, if everybody remembers, it was on the master draft waste plan. So we did send that out, and I got response that they received it.
Okay. All right. I have no issues for this meeting. So unless anyone else wants to bring something up, we should schedule the next meeting. Looking at my calendar. So the third Tuesday would be the 20th.
Yep.
And that looks good to me. Does anyone have a problem with the 20th?
20th will work for me.
Okay, so then tentatively, unless we hear differently from Zayed or something comes up in the meantime, we will plan on our next meeting being October 20th.
Actually,
go ahead.
So yes, we can make a motion on that. I do have one other thing that I want to add to an agenda for that meeting now.
Oh, please do.
And so that would be Halloween is coming up in October, and we're
Yes.
going to have to think about what we want to do as far as Board of Health recommendations for Halloween. And I think that if we have the meeting on the 20th, that's probably a good time for us to come to a decision about what we want to recommend.
I think that's certainly a good point, and please put that on the agenda. Actually, I do have one more thing, since we haven't adjourned yet. Something that, particularly as it's been a rather cool day, may seem less of an issue, but is there any concerns about Triple E locally at this point?
No, I was, the state does send me an arbovirus report every week. And, we are still in the blue category, which isn't the remote, but it's the next lowest level. So I hate to say this, but it's been very, very quiet in the Triple E part around, in our section of Central Mass. You can go online. There's two very good maps, one for Triple E and one for West Nile. And we are, still in kind of the low for both. So keep our fingers crossed. And as temperatures get, obviously lower throughout the day and at night, that I believe that, the prevalence of Triple E will obviously be less too. Sorry, I cannot.
Great. Okay.
So I'd like to make a motion that we have our next meeting on the October 20th.
Second, Dr. Walsh. Yes.
Walsh.
And Dr. Ehrlich, yes. All right. So what we just need now is a meeting to adjourn.
Well,
sorry, motion to adjourn. Yes, Steve.
One thing. So we were talking about Halloween. I don't know if you were on the call today, but the state is aware that people are looking for guidance, and they specifically mentioned that they're mulling this over right now too. So by then we may have specific state guidance, anyways, on Halloween.
Okay, great.
Okay. So I'd like to make a motion that we adjourn, and I've got a private comment for Steve as well after the
okay,
meeting.
Fine. I second the motion. Dr. Walsh?
Walsh, yes.
Dr. Ehrlich, yes. Okay, I'm going to log off and.